Hello, everyone, and welcome. My name is Kim Peak. I'm with the Interior Health Research Department and also the BC Support Unit Interior Center, and I'm honored to be your host today. We would like to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. We would like to also acknowledge that you might be joining us today from a different place, either near or far. I wanted to take a moment to also acknowledge the traditional owners and caretakers of those lands as well. Welcome to the 10th annual Okanagan Embrace Aging Month, and thanks again for joining us. Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan, Interior Savings Credit Union, and also Interior Health. UBC Okanagan has joined the global network of age-friendly universities, formalizing its pledge to make UBCO more accessible, intergenerational, and committed to research programs that are informed by the needs of an aging society. If you would like to know more about the Age-Friendly University Initiative, have suggestions for us, or would like to get involved, please contact the Aging in Place Research Cluster, aging.inplace@ubc.ca. We'll also share that in the chat box in a minute. Embrace Aging Month was launched 10 years ago to celebrate and raise awareness about positive aging, and has once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregivers. Our goal is to inspire everyone to embrace positive aging. So some housekeeping items of note include the closed captioning function. So the closed captioning box can be moved to your preferred place by clicking and dragging it to where you'd like. This is located on your bottom bar of the Zoom. To turn off the closed captioning, select the Hide Caption button on the menu bar. Questions, please feel free to type questions or comments for the speakers into the chat box during the presentation at any time. Questions will be read at the end of the presentation. And one more note is that you can also raise your hand when prompted by the speakers. So this option is located on the bottom taskbar as well, and you can lower your hand by clicking the function again. So without further ado, today's event is brought to you with the support of Embrace Aging Month. Today's session is titled Virtual Reality for Older Adults, Health and Wellbeing. And our speakers include Joanna Harrison, Executive Director, Seniors Specialized Care Transformation with Interior Health. Karen Littleton, Director, Clinical Services, Pandemic Response with Interior Health. Paula Morrison, Research Coordinator, Research and Quality, Long-Term Care and Seniors Care with Interior Health. Michelle Smith, Regional Practice Lead, Research and Quality, Long-Term Care and Seniors Care with Interior Health. And Jake Pichar, my apologies if I mispronounced your last name, Growth Manager within Rendever. Take it away, team.
Thanks so much, Kim. I'm going to open it up today. So thanks everyone for joining us. My name's Joe. I go by Joe, my shortened name. I'm honored to be here today and to share this space with you. First of all, I'd just like to acknowledge and recognize that I come from the traditional and ancestral and unceded territory of the Secwepemc Nation in the interior of British Columbia. I just share that this is a bit of a passion project for me. It's a very exciting journey we have been on, learning about virtual reality for older adults and their health and well-being. The objective today is to share an alternative way of care through the use of virtual reality in our long-term care homes within the interior of BC. But before we get started, sometimes I say to people, well, virtual reality, really, seriously, like for older adults, like, is that something we actually do? And the answer is yes, it is something we do. Next slide, Michelle. One of the things that we get asked sometimes, or I'll ask people when we think about virtual reality, is we are looking at the use of these devices for people young. We're often think of our younger family members. So sometimes we'll think of people using devices such as gaming. People will put the headset on and they'll use them for gaming. So you may see or hear your nieces, your nephews family members that have these devices that they put on and they'll use for gaming and experiences. But I'll often ask people, I say, but how many of your parents, your grandparents, or anybody over the age of 70 has actually had experience with one of these devices? And more often than not, when I ask people in the audience whether they have had experience with those older adults using the devices, I get the answer is 0. So really the journey we have been on in interior health is to change that number. We want to make sure that people have experience with using things and technology in a different way than we've never done before. So it all started with us with a question. I asked myself many years, well, it was many years now because we started this work in 2020. I asked myself, why can't older adults also experience virtual reality? And asked myself some questions about what beliefs and assumptions do I hold? And I see them as being true. Like in this example is, you can't teach a dog, an old dog, new tricks. Do we really believe that seniors can't use technology? Is this true? Why should that be true? So these are the things we started to test our assumptions and hold ourselves to look at that and think about this differently. So we started to see and ask ourselves whether virtual reality could be beneficial for those residing in our long-term care homes, especially during a time in 2020, which was during the beginning of the pandemic. Michelle, I think we need to share the presentation. It's not showing up on the screen.
Sorry, everyone. I'm having a bit of a challenge with the slide we were working on.
That's okay. You're able to go to slide 5, Michelle?
Yes. It's really, we just practiced this. I don't know what's going on. Okay, I can only see the full screen, not the notes part, so.
That's fine. So, yeah, one more. Thanks. Nope, back. So while we do that, I was thinking of going into some of the summary around the research and what we actually find in our care homes right now. There are many times when people in our care homes are unfortunately suffering depression and isolation. You may also know your loved ones that are experiencing sort of that loss of that zest in life. We knew that in the early stages when we had the pandemic, what we heard was significant hardship and suffering inflicted on residents and families because of loneliness, separation, and guilt. The collateral damage really of the restricted visitor policies was substantial. And in addition to all of that, many of our health workers were also suffering what we term moral distress. We also had reports pre-pandemics. Our BC Seniors Advocate report had found that actually previous to the pandemic, over 55% of families were visiting our care homes for residents for at least an hour or more several times a week and even daily. So you can imagine the difference this would have in a time when we were no longer able to visit our residents as we had done in the past. We also know from statistics and what we find is that almost 48% of residents are assessed as being what we term low on the social engagement scale. So they're not getting engaged and they're not being involved in the work we need them to do. So, and unfortunately as well, the percentage of residents with worsened depressive mood in long-term care is getting worse, with almost 20% in BC. And I like to remind people here as well that, you know, mental illness is not a normal part of aging. Some people have, again, this mixed belief that as you age, you're an older adult, and then they starting to get lonely or depression. It's like, oh, well, you're getting older. It's like, no, this isn't normal in a process of aging. So when we started this work as well, we went into some of the research to find out what had virtual reality been used, has it been used, how has it been used in previous research world, because it was new. We were entering sort of a new era of this work. And in 2020, Ontario had done what was termed a feasibility study. They'd used sort of as like a Samsung device that they put over glasses to take a look at how they would be used as a potential for enjoyment and relaxation for residents. And they had used, in that particular study, they used a 6-minute loop of nature videos that people would watch. And they actually found some benefits from that work. They found that the people were more engaged. And there was some learnings from that people found that they actually needed something slightly different, as a 6-minute loop of the same video may work initially, but then after a while it becomes the same. So that led to further research or further interest in the topic. Another study was done in South Korea that actually looked at alleviating behavioral symptoms and possibly using virtual reality in patients with dementia. They found that it was, again, another feasible option for participants. It provided them a great deal of satisfaction, and it confirmed that the devices were safe and convenient for use for clients with behavioral symptoms of dementia. So we know in the early stages that this was an area that we could explore and potentially use it for us in BC. And fortunately, as we will show later, we managed to seek some support, some friends in the process around this journey. Next slide, Michelle. But in the process, no, we didn't go on Facebook, Instagram, or TikTok, but what we did do is partner with our Health Excellence Canada in looking at to support us in some specific virtual reality devices, funding, equipment to help in our care homes launch this as a pilot and a starting point. We really did this through use of the technology and platforms that we'll guide you through later, and engage the heart of the home through our recreational programs and our frontline care workers, and enrolled several care homes in the process. We wanted to look and experience in-person virtual reality through the headsets and what difference it could make for our clients in our care homes. And you have to remember, when we first started this, it was back in 2020, 2021. And despite those being challenging years, we were in the middle of a pandemic, and many will also know in the interior of BC, we also suffered significant wildfires, flooding, heat domes, evacuations, you name it. It felt like the interior of BC had it. So the fact that over that time, we still managed to maintain and grow the virtual reality for our loved ones in our care homes is fabulous. And I think it shows the demonstration as to what value this is having for those that are using it. But really, what did we find? So Michelle, next slide, please. When we did this work, we progressed through a phased approach of implementation. We brought on our first care home in the spring of 2021. And as of today, we now have 20 care homes, which is almost half of our interior health owned and operated long-term care homes have access to virtual reality for older adults. When we do this, we receive the equipment, we get their engagement programming platform, we do staff training, and now we're at the stages of collecting some of the data and the experiences from residents and families on the outcomes of using this device. We've looked at some sort of objective data and the experiences and feedback from staff and from residents in the process, and doing some pre and post assessments. I'll just show you a couple of those in the slides right now. So next slide, please, Michelle. This shows you a very quick example of one particular resident. In this case, you're looking at a depression scale that we will use pre and post the use of virtual reality. This is just one example of a resident from April to September in 2022, where they had sort of a higher, the lower the score, the better on this one. So higher depression ratings give higher a signal that you are suffering from depression. And then in this particular case, we used the virtual reality as a tool to alleviate the risk of depression in an older adult. And you can see here we had a significant reduction in the depression ratings between the period of a 6-month trial of using the virtual reality. So you start to see some significant gains in the information and the effectiveness of using virtual reality. But it's not just the objective information that we had some significant benefits with. Next slide, Michelle. We found through doing this work, there are several other benefits of doing this. And these are actual quotes that have come from our residents with using virtual reality. And I really like the last one in here, the one in the orange. Says, I don't really like gimmicky things, but this is really good for us. So it's just, I can imagine myself saying the same thing because it would be so true. So it's really, you can go in as well with having one mindset and coming out of this really having a shift and knowing how and what it can do for people. Another example I want to share just before we move on is where we've had a situation where a resident was bedridden and a family member was using it next to them and they're both sharing the headsets. And it was a moment where they both had the opportunity to share the experience together and be involved with one another in a way that immerses them in a same experience. And the resident themselves can go to places where they can't necessarily physically go to. So it gives them such a way of engaging in a different manner with family, with friends, with staff. We've also had situations sharing as well where two married couple both wearing the headsets and holding hands together with a group and connecting on what they're seeing with each other outside of that care home in the experience. So it really is such a fabulous way of bringing a different way of thinking how we can provide that engagement for people. Next slide, Michelle. But it's not just the residents that are enjoying this and the families. We actually had a number of staff comments as well that have come through and seeing the value in this. So they are saying it's like, when they've tried it, it's like, oh, it's almost like meditation. It doesn't matter. They're saying it doesn't matter if you're 50 or 103, it's the same for everybody and it's good for any age. The other thing that we're seeing as well with staff is that it provides a good way of engaging with residents in a different way of doing tasks and doing work and being with people. I think it's a great opportunity for people to discuss and experience this together, and it gives another way of having the conversations with residents and learning more about them. Maybe they want to go somewhere in Google and go to an old home that they used to live in a town and talk about where they grew up and what it was like. So there's lots of opportunities for this. But I'm a fan of, next slide, please, Michelle, of a picture speaking 1,000 words. And I think this picture speaks volumes. So I just love it. You'll see we've got many other situations of residents that are also experiencing the pleasures of the virtual reality. And I'll remind people, it doesn't have to be relaxing. We've got many people out there that are daredevils, and there are some tools for them too in this. So really, as before I close it up, I mean, next slide, Michelle, please. I think if I go back to the beginning and I talked about teaching an old dog new tricks, this taught me a number of tricks. What we learned from this. I certainly learned this isn't about age. You can teach an old dog new tricks. You can teach anybody this use of technology. Through the process of the pandemic and on now, we're looking for win-win situations. We found a solution that could work for many people. And in this case, it's not only working for the residents, it's working for families, it's working for staff, it's working for everybody in the home, and it's bringing people together. And the one I like is don't be afraid to try something new. You might just surprise yourself. And this is one of those ones where it's, you know, come across a little scary to start with, but it has been working out fantastic. And when we look at digital technologies and how we tend to use it, with this work, and we'll go into a bit more detail as well, is you can actually tailor it. You can tailor what you need through these devices to suit the needs of the people that you're caring for, so that it doesn't have to be a one size fits all. So thank you. I'll pass it over to Karen, who's going to go through a little bit more.
Thank you, Joe. It's a nice segue, and appreciate the transition into this. So just for people on the call, fun fact that Interior Health is one of the largest geographic health authorities in the entire province. It is the largest health authority in the province. So I'm honored to be here on the unceded territory of the Silks people in the Okanagan Valley. So for the last few years, I've been the pandemic response director in this area. So just honored to be able to work with Joe and the team with the virtual reality and long-term care. And as a leader throughout the pandemic, and as a previous recreation therapist way back when, I've been reflecting on the lessons learned through the pandemic. And we've all heard of the person-centered approach, and more than ever now, we need to look at the person-centered approach and the well-being for our residents and staff in long-term care. So I saw two opportunities as I reflected for a renewed focus and better teamwork through person-centered care. So I'll just comment on a few of those reflections. So for the renewed focus, it's here we can also meet the individual needs, as Joe said, in our residents that are in care homes. Through person-centered care, and the World Health Organization defines person-centered care as organized around the health needs and expectations of the people in care, not their diseases. So I like that definition. It fits with our motto. People-centered care adopts the perspectives of the people in the care and for the people providing the care. So you see the resident, the family, the care workers that are closest to the residents and their community. So it's personal and individualized, as you've seen with the VR example. Remembering always to include residents and their family and our community in any of the long-term care programs we provide. And it may not look like the traditional bingo and the activities you see on calendars in long-term care homes. And virtual reality certainly is different to some people who are used to the traditional programs. And I've just on reflection again, I believe that all types of electronic devices, we've also trialed magic tables. They're really a digital table that residents can use to interact outside the facility, and either one-on-one or on their own. And so it's not the only innovative device that we're trying to support our teams to utilize for that personalized individual experience. So the second opportunity is that looking forward to the improved teamwork. We've observed that improving communication and collaboration between people leads to stronger teamwork, higher morale in our staff, and improved coordination of care. So improving the quality of the care that our residents are receiving. And overall, we have our environments look like a state of well-being for the people that are living and working there. So to transition, we have a really nice segue here. Would like to introduce you to Paula Morrison, a research coordinator as well as a family member with lived experience with family members in care and community. And Paula is going to share one of our most recent live versions of a person-centered approach in VR at one of our care facilities here in Kelowna. And I have a disclaimer. Aging looks different for many people in many ways. And whether you're, like as Joe said, 50 or 100, 50 to 100, the person in the next video is self-directing his own leisure experience. And the recreation staff are really, you can see how they bridge the gaps and the goals for this person in his VR experience. So take it away, Paula. Thank you.
Thank you, Karen. Thank you to the teams that have implemented the virtual reality in homes in recent years and the many homes that are continuing now with this ongoing rollout. Their willingness to do this important work is bringing joy and improving quality of life for residents. It's my honor to introduce this video that highlights the Rendever virtual reality system that has been implemented in Cottonwoods. Specifically and rolled out by recreation therapists Lauren Napton and Michelle Wingfield. I hope the joy resonates with you, and I ask you to watch for the pride of the care team as they share with you this important work. It's important that we see them for the caregiving role that they bring to this space, and I invite you to take in this video. Michelle's gonna launch it, so.
Go skiing.
I like skiing.
Virtually, that is. The 50-year-old has multiple sclerosis and lives at the Cottonwoods Extended Care Home in Kelowna.
There we go. We're seeing it now.
Morning, Gerald. Hi, Daryl.
Gerald Hardichuk is about to go skiing.
I like skiing.
Virtually, that is. The 50-year-old has multiple sclerosis and lives at the Cottonwoods Extended Care Home in Kelowna, where virtual reality or VR technology is allowing him to do things he otherwise would not be able to experience.
You're snowmobiling, motorcycle ride, the roller coaster. What are you thinking up to do today?
I want to do it all.
You want to do it all. Okay. Let's get your headset on, okay?
With a special headset on, Gerald hits the slopes, experiencing what it would feel like to ski again.
It was sweet.
Sweet? It was sweet?
The clinical rep therapists at Cottonwood say VR is making a positive impact.
We do pre and post session evaluations after every session, and consistently throughout, every single resident that uses VR says that they are feeling better after the session.
Interior Health started using virtual reality in 2020 during the pandemic as a way to support residents who felt isolated due to a lack of social interaction.
It was a way that we could bring the outside world in and allowing our residents to have these moments of joy that they wouldn't have, especially over COVID. And we've kind of just been rolling it out ever since.
Technology now being used at 19 Interior Health facilities.
As a rec therapist, it's hard to program for every single person. So it's beautiful having this tool that we know we can engage someone successfully with this tool.
A tool that's enhanced Gerald's day-to-day life, someone who prior to his diagnosis led an incredibly active life.
The first thing they told me was he rode a roller coaster. And it was just so cool to hear that he got to go on a roller coaster because he hasn't been out of a wheelchair in 15 years. I think he did a few things that were things he's done in life and had goals to do in life before he had to live there. So it was just such a neat idea.
An idea that's becoming reality in more and more care home settings across the region and province. Claudia Van Emert, Global News, Kelowna.
Thank you for that. So powerful. It makes me emotional every time I see it. And hearing the family speak of it, it's powerful. And to see the interaction between the staff and the resident is incredible. So I'd like to say that digital health will permeate our healthcare system, and we're seeing it happening now. But we're also seeing it in ways that we have never experienced before. This was just an example of embracing aging in the era of digital health. There's a brighter tomorrow, and it's right in front of us. And I'm glad that we're embracing it. If I could please hand it to Michelle. Thank you.
Thank you, Paula. So I'd like to introduce, we've been doing a partnership with Rendever and Interior Health, with the VR virtual technology equipment and engagement programming platform that we've brought into Interior Health. And we've been quite amazed on all ends of what's going on, and the programming that's geared towards the people that we work with. So we have a couple quotes from homes, or from Joanna's on here. We got two. So we have a Prondosa Lodge, and Joanna brought one for as a leadership long-term care in Interior Health. And I'd like to, part of the work we did bringing the virtual reality to the homes is we wanted to make sure this was something they wanted. So, and there was homes showing interest prior to it. And when the funding came, like Joanna talked about, we went out and Rendever, Bobby and now Jake would do demonstrations. So we would bring the headsets to each of the homes, and we would have demonstrations. They would run the tablet and the headsets you'd put on, and everyone could try them out, and you get the full immersion of the experience. And it's really we have many, many examples of even just that. And they would be an hour at a time, and they'd be all over the Interior Health region, everywhere. We'd bring it forward, and it was just that piece alone showed us that there was value in moving forward and finding the funding and keeping it going and working on our partnership and what we're doing together, because we all share the same passion to move forward, and we come with different skills and technologies, and just bring it forward. And so I will bring it next to Jake, who is going to give us some more information and do a tablet demonstration. We don't all have headsets, but it is a very good example, and at some point you might be able to try them. And I will pass it over to Jake.
I don't know how I can follow up to the wonderful words that everyone else on this panel has shared. I'm trying to catch my own emotions right now, and I'm so filled with gratitude and appreciation for every single staff member that's been a part of this project at Interior Health. And to hear where the need and the goal came from was to ultimately serve your family members and the residents with Interior Health, in a more immersive, engaging way. And to hear that we are doing just that, and to see the expansion opportunities with new care homes. In my voice, I am trying to keep myself, but I'm so filled with pride and appreciation for everyone here, and Michelle, being able to work with you and on a whim lead a demonstration for a group of residents has been one of my honors working in this role. So now I get to proudly share the numbers that we have as far as usage analytics. And this is only since November of 21, as this is when we had a little bit larger of an expansion with most of the communities. But if we take a look back, this is only about 14 months. Interior Health has ran more than 1,000 virtual reality sessions for the residents. This has turned into more than 5,000 specific experiences delivered, over 9,000 moments. And in total, they have spent more than 18 days inside of virtual reality headsets, and more than 432 hours. I thought it was fun to break down. That's a lot of hours. And what we'll see after I share our product demonstration, you'll know what activity guides are. You'll know what videos are, search locations, and interactive applications. But I wanted to show the usage variety that each of the care staffs are being able to pointedly work with a resident that wants a little bit of action that day and to go skiing. That's where the video experiences will come into play. The interactive applications, if someone is maybe going through a little bit of an agitation period, we have calming mindfulness applications that are able to pointedly help your loved one relax in a way that maybe wasn't possible before. So it's from here that I'll be able to switch gears, and we'll actually be able to show you the program that we've been talking about for the last 30 minutes. So without further ado, I will start sharing my screen. And this is our tablet controller. What I have in front of me is what controls the headsets at each of one of the care communities. The staple of our company is that we network our headsets together. I heard Joe a few times allude to a family member and the resident. They're sharing the experience. So when they're traveling back to that trip they took in Hawaii, they're both pointing things out, helping each other see things, and tapping into memories that, unless you are immersively looking at the hotel that you stayed in 20 years ago, it may be hard to recall some of those deeper memories. But if we can get those out in a conversation with you on site as a family member, with the care staff that Interior Health has, what we're seeing is it's leading to more trusting relationships, higher engagement scores. And it's actually here, before we jump in to the really fun part, hopefully, of this meeting, I have some numbers to share with us. Recently, we conducted a case study with another group. This is not public information, so we'll only be able to share the data that we collected. But we also used a modified Lubin social network score to study over 8 weeks. How would residents take to 2 VR sessions per week? This is what we found. Their global connection improved from an average of 34.2 to 71.3, feeling significantly more connected to the rest of the world. Peer connection improved from 59 to 78, feeling significantly connected to their fellow residents. Self-connection improved from 46 to 71, which reflects improvements in autobiographical memories and feelings of autonomy. There was also behavioral evidence showing positive social interactions, including when the VR headsets were off. They sustained this over 9 weeks. And what we found over those 9 weeks were still a 24% increase in the level of trust between residents, a 29% increase in enthusiasm for life, a 23% increase in energy levels, and my personal favorite, because VR is tapping into the pleasure network, we saw a 27% increase in pleasure from food. So all of those numbers that we're finding are incredibly impactful for us to let us know that we're on the right path, as our mission since day one is to combat social isolation for older adults using the power of shared experiences and virtual reality. Meetings like this, webinars where we get to hear the impact that we're making for the residents, makes it all worth it. So outside of the above great stats showing an overall quality of life improvement for residents, another very impressive stat was that residents showed a significant improvement in their overall feeling of satisfaction for the community that they resided in. This went up from 59% pre-VR sessions to 83% post-VR sessions. So I thought that was needing to be included in this presentation to show you other case studies that we're running to make sure that we're proving out all of the great anecdotal evidences and stories that we collect along the way. So now we'll switch gears over to our program, where I cast my tablet to the screen in front of us. And immediately we're brought to a dashboard page letting us know what our most recent activities are. Michelle and the care staff know at Interior Health locations, we push updates every week. So new tours or new videos are automatically downloaded onto the staff's tablet. So Monday morning, they have new things to experience with the residents that week. In the world of golf, we know that the Masters are coming up. So what we do is aim to make sure that we're a part of the conversations and communities. We're a part of celebrations, seasons, anything that we know is happening at the community level in conversations, we want to try to attach ourselves to. So now we'll begin and look at the 7 features that we have listed always on the left-hand side. And first we'll see activity guides. Remember, that was one of the numbers that was very heavily used with the usage analytics we shared. And it's no surprise, because these are educational tours, pre-prepared lessons that we have hundreds of these that the staff, they just have to pick which one looks inviting that day. They can ask the residents which tour that they would like to travel on that day. And I'll scroll down to show us all the different categories we have. And I think all of you will be very, very happy with one that we see, that we do not forget Canada at all. In fact, we have a massive footprint up in Canada. We couldn't be more proud to partner with as many organizations as we do. And our VP of Customer Success also resides and is based in Toronto. So we also make sure that experiences and our new content is also related to Canada. I'll go down to the travel section. This is my personal favorite. What we can do is hit not that button, but the hamburger icon. And that expands out and lets us see all of the different tours within our travel. I have to go to the one at the bottom because it encompasses one of the locations, I think, near you all that I have to share. And if any of you have been here before, I need to know because I also need to plan a trip there. You saw the variety if you were looking at all the different tours, and that's on purpose because I've seen it and heard a few times from the other members on this panel that it's about the specific resident approach. Not all residents are going to love gardens worldwide, but for the residents that ask for gardens or botanical gardens, we have something prepared and ready for them. Castles, spring traditions. So the variety that we're able to provide for residents that staff always know there is something for everyone is what helps us be confident in the programming that we provide. So let us go to Zen Places Worldwide. All we have to do is tap that start button, and all of a sudden, the VR headsets are automatically transported to this dock. So now, some of the locations that we're in have 2 headsets, some have 4. All of the 2 or 4 residents in the headsets are seeing the same thing at the same time. So when Miss Betty looks over to the right, and she has an observation of maybe that hut, well, if she says anything, I promise you the other 3 residents will not be able to help themselves. Also look in the direction that Miss Betty is pointing out. So while they're with each other every step of the way, that's them being together in a social experience. And every time after they take the headset off, the conversation does not stop. If anything, they're more curious. They talk about the next location they want to go in the next VR session, or what we'll see in the next feature is the reminiscence ability that we'll see with this tool is like I've never seen before. So the amount of organic memories and stories that the residents are able to share, that the staff can be witness to. So that's important for the staff to get, those different inside jokes. As many things as you can connect with a resident on, it makes the residents and staff's enjoyment in programming and their relationship a bit stronger. So let's get back to the program. That these are still image tours. And this is important for us because if a resident for the first time put on a headset and we had them go on a roller coaster or even walking forward, we know that there might be a chance where it's uncomfortable. It frightens them. So it's why a lot of our platform has no movement. And you'll see on the next feature that we share, the way that we bridge residents into the headsets has them almost making sure that they will be a reoccurring guest at the VR programs every single time. But as far as what the staffs get, look at this. The information that we provide lets them be the expert local tour guide. We also, of course, have trivia questions at the bottom that will, again, push for more engagement and conversation amongst the residents. So what we try to do is make it as easy as possible on the staff, give them as much tools and information as possible. So what they're worried about is making sure that the resident is having fun and enjoying their session. Now, for time purposes, we're going to skip forward. All I have to do is tap that little arrow button, and that moves us to the next location on the tour. It is very often that anyone that goes on this tour looks straight up at the massive waterfall. So you very quickly see how interactive it is, how you're able to point out things to the residents, and you don't have to do that too often before they take over the session and they're leading the conversation, which is what we're all about. So here's where I really have to get to the last location on this tour because, again, it's close to you all, and I need to know if anyone's been there. This is one of my favorite places that I will ever bring people to in VR. This mountaintop in British Columbia, I'm not sure if we have the exact location, but look at this. Every single color of the rainbow is scattered throughout the mountainside. We're on top of a beautiful mountain. I even think the gray clouds help the colors pop a little bit more. And look at when we spin around. Oh my goodness, they've prepared a wonderful dinner for us on top of this beautiful mountain. And look at how we got there. I guess we got a helicopter ride. So the ability to look in all directions, observations, and that the residents are with each other every step of the way is how we're combating social isolation and bringing experiences to residents that they probably or likely won't be able to have again. So what we really do is we bring the outside world in, and really what we'll see in the next feature is we really do have access to the entire world. We have a street view integration, meaning I can type in any address, any place, any town in the entire world. And with a 99% confidence, we can get a resident exactly to a place they've either always wanted to go, or they have a fond memory that we can help them relive by getting them back looking at their favorite restaurant. And for an example, we'll go to a quick popular one. Say one of your family members or residents, a dream of theirs was to go to the Eiffel Tower. Look at that. Within a few seconds, we are literally standing underneath the Eiffel Tower. Beautiful cotton candy sky in the distance. So what this does is when the residents finally get to a place they've always wanted to go, well, they won't be able to hold back their excitement. And then the curiosity wheel starts spinning. Well, where else have I always wanted to go? What memories do I have that I want to relive with my favorite staff member? Or, hey, Betty, come on over here. Let's go on a trip together. So the possibilities for conversation, for travel, and reminiscing are so incredibly powerful with the Explore feature. You can even, like I said, type in exact addresses. And here on the right side of the map, it becomes interactive. So if I knew a place or a restaurant that was close to the Eiffel Tower, I can interact with it and go to exactly where I want to go in the world. And I think to show everyone how impressive and how much of the world is mapped out for us, I'll zoom out, and everywhere in blue is where we have the opportunity to go. Now you keep seeing it just becomes darker and darker shades of blue. And there we have it. We can get to almost every single street in Europe. There are a few Northern Canadian locations that, because of Google, it's either a very private road or it's rural. So Google hasn't been everywhere in the world. We're a little bit at the mercy of where Google and their street view vehicle has gone. But most locations in the world, we're very confident that we'll be able to get your family members and residents exactly where they want to go. So Passport, we'll be able to skip over this one pretty quickly. This is a country-specific feature that if Susie wanted to go to Spain, I as a staff member don't have to think too much about, oh, well, what do I know about Spain? You know, Miss Susie, is there somewhere specific in Spain? We have a feature ready to go that we just click on Spain. And this cycles all the different opportunities within our platform about Spain. So here's where we'll give Susie a few options. Susie, do you want to see highlights, heritage monuments and landmarks, Catalonia? What do you think? And she'll pick one. And then you're off and running on a playlist, preloaded, pre-populated, where now Explore, although it doesn't have information being a local tour guide, you get dozens of locations centered around this specific theme, which is monuments and landmarks within Spain. So here we start in the beautiful La Sagrada Familia. This is just one stop in one tour. The next one, we can go to the Cathedral of Sevilla, and I will butcher most pronunciations, so that's why I'll probably stay away from most. And you can just see the vibrancy of the colors, how much they change. And it's also maybe a great insertion point where those residents who are maybe sometimes legally blind, have macular degeneration, or are farsighted, or whatever it is that they cannot see far, they report being able to see colors and in virtual reality much better. And I've been in some of those rooms where a resident who is either colorblind or has macular degeneration, they're almost, no, that won't work. I don't want to try it. How much that flips on its head, because then they get so excited. They have not seen far in decades. They haven't seen a color. They haven't seen the color blue in years. And the appreciation they have again for being able to just see again is extraordinary. So I thought it was worth mentioning that as we see some neat, vibrant colors jump back and forth through this playlist. And I think it's here where I'll share the number of locations that we can get to. And again, this is the street view data we get to work with, but there really are trillions of locations that your residents and family members can get to using this platform. Everything so far has had no movement, but the value is in the conversation with your loved ones. It's in the travel and in reminiscing about their fond memories. One of them that I personally like is, what's your most embarrassing memory? Now, if they're willing to go there, I promise, get them back to where they had a funny, embarrassing memory and just watch them share that. I mean, the laughter in the room, I mean, I had a stomach ache after I heard one of them. The quality of our questions can equal the quality of the conversation with the residents. So those past features where there's no movement, it's really for the engagement and getting to know that person on a more personal level for what makes them significant. And next, we have a new significance realm, which is videos. We finally introduced movement. And if we see the top two categories, adventure, athletics, which are a bit more to the thrill seeker, we'll scroll across and see other options. But other programming opportunities we have are chair yoga sessions. So we are excited to get more into the specific programming that different partners are looking for from us. We can go on a seaplane landing. There is one gentleman, quick story time, that his one dying wish was to go fishing again. He was on hospice. He did not have the opportunity to go fishing. We rush ordered him a headset. And for every day until he left us, he went fishing in Texas. We got a follow-up from the family that had told us how powerful and how much more ease he was at the end of his life and what that did for the family, letting them know and giving them comfort that their dad passed being able to do his favorite activity in life. So that's really what videos are for us, bucket list items for your family members, for your residents. And Michelle knows this, her staff know this. If there are gaps, if there are things we do not have, that's exactly what we want to know. So what are the bucket list items of the residents within interior health? We collect those and we look at what we're able to produce or connect with potential content partnerships. I think I will jump into one video, and it's going to be an animal video. As we heard from a lot of our partners through COVID, a lot of residents missed those furry friends. They weren't able to come into the community. They didn't get to take that local trip to the zoo or have the alpacas or llamas come outside. So the animal therapy was incredibly important to our partners. And we have dozens of animal videos. They're by far the biggest category that's played within our ecosystem. But let's, cheesy joke here, dive in where no scuba gear is necessary. We don't even have to put a swimsuit on. And this is what's really cool is if a resident has maybe a fear of swimming or I've always wanted to, but I can't swim well. Something like this, you just see them flip and it almost empowers them because they're able to do an activity they never thought was possible for their own limitations that they might have set on themselves. But here, and I'll skip forward, they get to scuba dive underwater, and very soon that cloudy black, cloud in the distance will turn into dozens of dolphins swimming around us, flipping over our heads. There is, which we won't be able to hear through this casting, a beautiful, serene, deep ocean music. So there is a musical or an audio element to all or most of our videos. That could be a narration, it could be background music, it could be the natural noise. But here, can you imagine being able to swim with dozens of dolphins, especially if you either never thought you could, or the flip side, if you were a scuba diver and this was your greatest interest. This is now a tool that's able to help that resident reconnect with what made them light up, with what made them fill up in their mission in life. So here we can see from a little top view, the dozens of dolphins. And then at the bottom, what we do is share prompts for the staff that we saw pop up a little bit. I'll scroll to the next one. But this is always, again, looking for that extra level of conversation, engaging the residents in meaningful ways. And here one will pop up. Could be a question or an observation, but here, has anyone seen dolphins in the wild? Have you ever seen this many? Who knows if a resident takes that and says, Yes, oh my gosh, I have actually been a scuba diver before. Well, then we know what's about to happen. That resident is going to get their time to shine and share a little bit about their scuba diving experience. So videos in a nutshell, being able to immersively bring your family members and loved ones into their favorite pastimes, bucket list items, or something very, very generic, something very soothing. Like at the bottom, we have walking tours of dozens of countries within Europe. So again, the variety is something that we know is important to share, because if there's one thing that we've learned amongst many in the 7 years of business, every community is different, every staff member is different, and every resident is different as well, which means we better have a model or a solution that's able to fit every single one of those variables. And we're really proud to say that it does. So these are videos, bucket list items. And if there's any crazy ideas that you all have, maybe for your family member that's at a community with Rendever, feel free to either drop them into the chat, my email, which I think will pop up, Jake, very simple, @rendever.com. As some people have said, we eat, live, and breathe content ideas for breakfast, lunch, and dinner. So any crazy ideas that you have, it helps us become better and service our residents and partners better. Next, we have interactive applications. We're going to jump into two that really show what each of these are. I Spy. Now, I assume that most of us have potentially played I Spy with our kids, or this was the game you played on the playground or in school. We made it in a VR way that motivates movement and competitiveness amongst the residents. So we're going to load into one of our environments, and the tablet gets to share with the headsets. Okay, everyone, find the robot. Now you're having a headset and there is eye tracking. So the direction in which you move your headset, it will point at that toy robot. And what happens next? Confetti flies, you're given a point value, and then you move on to the next item. This game goes through 10 different items, and we have a leaderboard. So who of the residents finds the most items in the quickest amount of time will win the game. That leaderboard again will pop up after 10 objects that we'll see very quickly here. It is of the staff member's choice if they wanted to input the first name of a resident that can make it to our larger community leaderboard. Here you can choose to skip the leaderboard, submit, exit, play again. But that's one of the examples of how we motivate movement and maybe tap into that competitive spirit that we know bingo brings to so many residents. The next one we have to share is a pointed relaxation and mindfulness application. We did see great usage from this, so this tells me that the care homes are finding ways and examples that some of the residents maybe have agitation periods, that this tool is able to encapsulate their attention and bring that energy maybe back down to a more positive fashion. So what do we have here? We're situated in a beautiful mountain side. We curate a breath bubble. The staff picks the pattern. So there's 3 different ones. These are the most common human breathing patterns. We can also open up some environment sounds, which is an ambient noise of crickets. And then, of course, we pick another piece of background music. So the resident is focusing on this breath bubble, immersed in a beautiful environment while listening to music. And we've heard everything from Jake, you helped this man's episode or his Sundowners episode shatter completely. I don't know how that happened, all the way to other staff members saying, well, it did reduce his episode maybe by about 25%. But Jake, that's made the world of difference for him. It's made the world of difference for our care staff, that even dampening that a little bit has made him more comfortable. So it's not always the best, the most grandiose reaction that we're looking for. We're looking for what a resident needs on that specific day. So my favorite concept in this industry is meeting residents where they're at. And we're proud that our platform is able to meet the expression of needs that a resident has on a specific day. And the variety that these programs offer could have a thrill seeker going dirt biking on one day, and maybe because they're not in the best mood or a little bit agitated, they're going through a calming mindfulness application the next day, and everything in between. Lastly, now I'll really have to try to choke myself up and get through this. This is what we're really excited to share. We're excited, Michelle and I are excited to share more of this with the IH sites that we're at. This is the family portal. As we get up into wedding season, graduation season, I know that there are residents or loved one of yours out there that aren't able to physically make the wedding. They aren't able to physically make the high school graduation, the college graduation. But if you as the family member are making sure that you collect videos and pictures, especially from a wedding, you're able to help your resident experience that important family day like they never missed it and that they were a part of that. Now, how I like sharing this example is the difference if this is Nick Abruzzo, he's our VP of sales. If he wasn't able to share this with his grandma who couldn't physically make his wedding, that conversation probably goes like this. Hey, Nick, how was the wedding? Hey, how was the weather? I know you were on the beach, but I hope it was good for you. That turns into, because she was able to be a part of this day, Nick, you were so handsome. I'm so happy that the weather was great for you. And oh my gosh, Uncle Roger later at the recital or the ceremony, I can't believe he was dancing like that. You help them become a part of that day like they never missed it. So what we see is it can bring down that level of guilt on the families, on the residents who, of course, they wish that they could make every important family event. But if there's something that can help them do that without being physically there, it is collecting that data in pictures and videos and sharing it through your virtual reality system. So they can be a part of that day, and they will probably, at least for the next few weeks, they might want to watch this wedding video every single day. And the last point I love sharing is, we know residents love bragging about their families, right? There's no better way than to get energy and conversation throughout the community, like family members, including the residents on their important days. And then Miss Betty screaming to the whole community, you need to come watch my granddaughter's wedding. And they will, and they'll have a great time. So that is a very long-winded, very quick explanation of what our platform is able to do. The last one that I didn't share was Rendever Live. This is a daily live program that we offer, and communities can tune in at different times for different sessions that we run. Very quickly, we developed this in response to COVID when we did see usage slip. This is our way that we run sessions for communities and staff members. They want a little breather. As a way to augment their time, we run 3 sessions per day. It's one of our goals that maybe within a year or two, we are running sessions every single hour so that people can tune in and always be able to interact directly back to us. So I'm able to now disconnect my screen, send another big appreciation back to the team at Interior Health for making my job possible to share what I just did, and the working relationship that we have with everyone, especially you, Michelle, just so filled with gratitude and appreciation. And so for everyone else who joined, I think they inputted my email address. If anyone has any questions, I'm happy to have any conversations with you all. But Michelle, we're going to kick it back to you, and thank you very much, everyone.
Thank you, Jake. I always love listening to the demo. Okay, Paula's gonna start us off with this slide.
We just want to thank you. Thank you, Jake. That's such a powerful presentation of it's experiencing it on site is another level of wow, but you really do bring it across. Thank you. Thank you to all who are supporting these quality of life initiatives and the ongoing rollout of this specific initiative of virtual reality. We want to name a few collaborations that we really want to give shout outs to, including, most importantly, it'll make me emotional to say, our long-term care residents, families, and staff. Thank you for what you're doing for our communities. Thank you to the recreation therapists that worked on these initiatives, specifically Laura Napton, Michelle Wingfield, and Andrea Naylor. who have been presented some of their data here. Long-term care research team members, Michelle is a champion, and I'm grateful to work alongside. My name's Paula, and Dee Taylor, along with leadership Joanna and Harrison and Karen Littleton. And we appreciate this support in doing this work. And Michelle.
I'll add some more. So Intel Digital Health, Network Infrastructure and Technical Support people in Interior Health have been just amazing to work with, and then work with Rendever. And yeah, so Andrew Pova and Nathan Hind have been two people like that have really championed on that side. And you need to have that technology support within the homes to make everything work as best as it can, and it does. The funding assistance, we've had their Healthcare Excellence Canada has done the majority, and we've also had Royal Inland Hospital Foundation come in as well. Thank you to them. They've funded a couple homes so far, and we're always looking for more hospital foundations and Healthcare Excellence Canada and more people to do that. Our coaching support for Healthcare Excellence Canada is April Price, BC Patient and Safety Council, and April coaches homes that do the LTC Plus program with the virtual reality and make programming make quality improvement programming for the home using it. And then for Rendever support and working with over the last 2 years, Bobby Allen, who also Jake knows very well and has done worked with since the start, and Jake himself. And then David Stoller, who is the Toronto Community, I've already got the title, and then Nick Abruzzo, whose wedding you just saw, who's also been connected up, and they've doing a lot of work with us as well. And then we will close the screen, and then Kim, we're ready for if there's any there so far, for anyone's questions.
Well, thank you everyone so much for that. Admittedly, I'm crying a little bit. It was the fishing one that got me more than anything out of this whole thing, and it's because my dad's getting older, and that's something I could envision being a conversation. I'm just so grateful and thankful that this exists. But keeping myself together and seeing all your strength will make me power through this. Please feel free, the attendees, to enter any questions or comments into the chat box. We did have a one sincere thanks from Danny Whittle before she had to go. I have one question that popped up for me and it's kind of for the group, is I noted the power and the need for connection, community, and collaboration throughout this entire journey. And I wondered if you encountered, I heard a lot about the successes that you've had, but I wondered if you had any barriers along the way that needed to be overcome.
I can start, Kim, with that one, and I think Michelle spoke to it very quickly around some of the infrastructures. So sometimes we think it's going to be a simple case, as Jake said, of bringing in the devices, the technology, the training. You think you got it all, and we'll bring it into the home, and we'll just switch it on, and off we go. And then you realize that some of the foundational components, such as having internet connection, which we may take for granted in many of our own personal homes, just simply isn't available, or the bandwidth or the speed and the connectivity that is needed in some of our older care homes. So I would say personally for me, that was one of our largest and biggest barriers in learning journey and going through this, which is why we've now engaged with our digital health partners to try and look at getting some of this work, like getting this in to our homes across, because virtual reality will just be one of many things that we'll see coming in for technologies in the future. So in some ways, I'm glad, as unfortunate that it had to be, we've lived through virtual reality, but I'm glad we're sort of seeing it now and getting on top of it now, because it's going to continue to grow.
Thanks, Jo. Does anybody want to
add to that? I can add that too, because yes, it was, and I think it brought a spotlight to the homes and to where it needed to be, that long-term care should have great Wi-Fi, just like everyone's home and the hospital. And so it varies at times in working on it. And I think we have a champion in the IT and the IT to kind of make this happen, because it benefits staff, residents, and family and everyone to do that. And techs. We're just going to keep having more technology. So we're just going to keep building on that. Yes. And then
Yeah,
barriers, go
go
ahead.
ahead.
I was going to say barriers. Sometimes there were some fires. We had to change some planning for some demonstrations at times, follow the roads and with that. But no barriers with the homes are always super excited to see it, and the family and staff are and residents and staff are really it was really great. Again, I know I keep saying that, but it was really a great experience for me and them and Jake and Bobby and everyone, and to do those. It's just really awesome. But I think that was the main, just some logistics.
Yeah, I wanted to add to that, Michelle. It's more perceived barriers, and I did mention the large geographic region that we all interact in. But the perceived barrier is with technology itself, both with staff and residents and their families. So it's new and it's busy. So we're trying something new in very busy, short-staffed environments. So there's fear. That's the first initial barrier we see. And we can see it in the lag time in response with sites. So again, Michelle and Paula have done plus degree heat and snowstorms to get into the sites to let them just try it and see how unintimidating it can be. So just breaking down those barriers. So that's just sort of a plus that this team's done.
Thank you. And we do have a question from Kaylee in the chat. She says, great presentation. Are you guys looking for a new site? For example, a Hillside Geriatric Program.
That'd be a great location.
Kaylee, I'm hearing yes. I'm hearing connect with Michelle.
Yeah, we can do demonstration and look more because it's definitely.
And is that Hillside in?
Yeah,
Kamloops?
that's Hillside. So that's right by that's by Ponderosa, I think. Ponderosa.
Okay.
Yeah, right, Kaylee? Kaylee? Oh, I can't speak today. I don't know why I'm even allowed to talk. But yes.
Yeah, and just some feedback. You'd be surprised how people that don't like restrictions like hats or scarves or think the earphones and headsets for some reason when they're engaged and it's meaningful, don't bother the residents to try it. So it's safe to try it. I don't think any have been broken yet, hey? And they clean up nice for infection control.
I actually noted that I have a little infection control background, and I was very excited to see this because it's very, very disinfectant friendly. And I was very excited to see that. So noting our time, we only have 2 minutes left. And Kaylee adds, it's right behind Royal Inland. Right, Royal Inland Hospital in Kamloops. So noting we have 2 minutes left, is there, I do have a question if nobody thinks of anything, but is there anything you'd like to leave attendees and everyone on today? Final words of wisdom and thoughts.
I don't know. Who's got some thoughts? Jake, Karen, Joe, Paula?
I mean, maybe I'll leave things as, like I said, a part of the presentation. Never giving up. Maybe that's part of it. You know, we're often faced with challenges. We're often faced with curveballs. We've had so many things hit healthcare in general in the last few years. I refuse to let that stop us from doing what is right and doing what is meaningful for those that we love. And we're in this industry because we care. So maybe I'll end with that. And as Jake shared and others, and it does bring tears to my eyes. I did a similar presentation last year in Vancouver. I had half an audience crying in a positive way, though, right? It's meaningful, and I think I'll leave it with that, is because this is a new way, and I'm not giving up on this. We need to make a difference in this industry, and we can do it. And curveballs will come at us. That's okay. Bring them on.
I love that. I think that's actually the perfect way to end it, with that strength and determination show. And you can see it's exuded not only from this group, but from the video shared and the experiences of community and family and friends and the actual people that are joining in and watching the VR. So thank you to Joe, to Karen, to Paula, to Jake and Michelle for everybody joining the webinar. We'd also like to provide special thanks to Jaquetta for facilitating all the stuff on the background in the back end and for coordinating the month's events. We encourage everyone to attend other events scheduled for Embrace Aging Month. You can visit our website, OkanaganEmbraceAging.com, for all events and registration. We look forward to growing this event in the Okanagan and beyond, and encourage anyone interested in supporting Embrace Aging in the future, please contact us. Contact information is available on our website. You will receive an email with a link to an online evaluation form, and we welcome everyone's feedback and suggestions for planning Embrace Aging events in the future. And thank you so much, just again, to everyone today and for all the learnings. And and we hope everyone has a lovely day. Take good care of yourselves and each other.